We're seeing 50+% reduction in sperm counts since the 1970s. There's some estimates that say that if this trend continues, that most people won't be able to have children without some sort of assisted reproductive technology as early as like 2060. So, and these numbers are really alarming and no one is talking about them.
Yeah.
Like, I don't think if you ask the average man that he would understand, number one, how important sperm count is, and number two, how drastically on the decline it has been.
You're listening to Sex with Emily. I'm Dr. Emily, and I'm here to help you prioritize your pleasure and liberate the conversation around sex. Today, I'm joined by Dr. Josh Gonzalez, a board-certified urologist, fellowship trained in sexual medicine, who specializes in the management of male and female sexual dysfunctions. In this conversation, we're talking about hormone replacement therapy and what we do and don't know about the use of hormones. He's also answering your top penis and vulva questions, and we're discussing load versus sperm count and how that affects men's pleasure, because a smaller load sometimes feels like a less intense orgasm. Also, men need to be proactive about their fertility, and hint, hint, it's a lot easier and cheaper to freeze sperm than eggs, just if you're curious about conceiving. I love talking with Dr. Gonzalez, and I can't wait to share his incredible work with you. Please rate and review Sex with Emily wherever you listen to the show. Just do it right now. It takes you 2 seconds, and it really helps get the show out to more people and more sex-positive people like you who want to have better sex. You can also find me on all social media at Sex with Emily. If you're there, I'm there. Check out my new articles, Is My Vagina Normal? And How to Have an A-Spot Orgasm. They're up on sexwithemily.com. Also, don't forget to sign up for my emails. You can find the link in the show notes. All right, everyone, enjoy this episode. By now, you've probably heard my Magic Wand story. It's a brand that's been part of my personal journey for more than 20 years. But no matter how many times I sing Magic Wand's praises, I'll never be able to fully capture the story of this incredible brand. Well, now journalist and author Kate Sloan just completed a limited audio series documenting the history and impact that Magic Wand has created over the last 56 years. It's called Making Magic, and the series chronicles Magic Wand's incredible brand story through interviews with nearly 40 experts, performers, business owners, educators, and fans. So I got a sneak preview of this series, and what I loved is that Kate weaves together snippets from all their interviews into this amazing story arc. She covers Magic Wand's journey from appliance store massager to its legendary influence on culture and sexual independence, and it's all just fascinating. The first episodes of Making Magic are available now at makingmagicseries.com or on all popular podcast platforms. Just search for Making Magic or visit makingmagicseries.com today. I asked my Sex with Emily audience their most embarrassing penis questions, and one that kept coming up was, how can I increase my ejaculation? Helped by the ever-growing popularity of the money shot in pornography, semen volume seems to be a conversation growing in popularity. So can you really increase your load? Well, the answer is yes. You've got to get your hands on Popstar's volume and taste enhancers. These supplements help build up semen and increase ejaculatory volume. Not to mention, there's an added bonus of improved semen taste. We've all heard that age-old rumor to eat pineapple to taste better. Well, this supplement actually uses the bromelain from pineapple along with zinc and L-arginine to improve your overall taste in 2 to 3 weeks. This product was created by 2 of the country's leading men's sexual health physicians, so you're in good hands. Popstar is all-natural, high-quality, vegan, and non-GMO, made from the best ingredients and scientifically proven to work. Plus, you know I've got you guys with a discount code. You can save 20% with code Emily at popstarlabs.com/Emily. That's popstarlabs.com/Emily. popstarlabs.com/Emily. Use code Emily at checkout. Dr. Josh, welcome to the show.
Thanks for having me.
I'm so glad you're here.
Me too.
Okay, so let's talk about what you do. What is a urologist?
It's a good question. A lot of people do not know. I did not know when I started medical school.
There you go.
So urologists generally manage everything having to do with the genitourinary system. So that includes urination, sexual function with things like erectile function, ejaculatory function. But it's really broad. So we manage urological cancers, bladder cancer, kidney cancer, prostate cancer. We do benign urological health conditions, kidney stones. difficulty urinating. And then, of course, there's the whole sexual health aspect of it, managing, various sexual dysfunctions.
Okay.
So it's nice because it's a broad spectrum of things that you can do, and you can kind of choose which path you'd like to take.
Okay, got it. And you also specialize in sexual health and wellness, sexual medicine. You studied with the OG.
The OG,
grandfather, Dr.
Goldstein.
Erwin Goldstein is just, he's done so much for women's sexual health too, but everyone.
Oh, especially, right? Yeah. So he was really, he was involved in the initial Viagra trials. Yeah. He's been doing this since like the late 70s, early 80s. Mm-hmm. And then, the last, I would say 20 plus years of his career have been really focused on elevating awareness of female sexual health.
Yeah.
Because so much of the conversation in sexual health focused on men for so long.
Well, I love that you're carrying that torch too. So if I'm coming to your office, what am I coming for, would you say?
I see, first of all, both men and women who have sexual health issues. I would say the most common things I see are erectile dysfunction, low libido in both men and women. Mm-hmm. We do a lot of hormone management. So women in menopause, offering them hormone replacement therapy, men with low T, putting them on treatments to increase their testosterone levels. I'd see actually a lot of pelvic pain, a lot of women who experience pain with sex.
There's so many who are listening, like, I have pain, and it could be so many different areas, right?
Yeah.
Do you think they start with you? What would be your first thing? If I just said I have pain, how would you take that down?
So we try to get them to be more descriptive about what exactly is going on, right? Because being clued into the details of their pain can help you diagnose what the problem might be. So for instance, if you're talking about a woman who experiences pain with sex, right? I ask them, how would you describe that pain? Is it burning? Is it raw? Is it a tight feeling? Is it sharp? Do you experience pain with initial penetration or with deeper thrusting or both? Have you had this pain your whole life? Mm-hmm. Or is this something that came on at some point? And those are clues that help us figure out what the source of the problem is. A lot of women have pain from sexual activity related to hormone deficiencies, right? A lot of younger women that I see that are on oral contraceptive pills can develop dyspareunia and sometimes not even be able to have sex, or they can't lubricate. And so we often will have to kind of undo the damage from some of those medications and put them on hormones to give them back the hormones.
To regulate, right? Because it's really just a depletion. Can we talk about that for a minute? I'm finding the birth control pill, this is controversial. Mm-hmm. I don't know why it still is, but I feel like there's been so much information out about how once a woman takes it and then goes off of it, it's really hard for her to balance her hormones once again. And there's a whole protocol, and it might never go back to the level, right, that it was at. Or that?
So I would say the biggest damage that is done by oral contraceptive pills is that they cause an elevation in a protein called sex hormone binding globulin. Mm-hmm. And that protein, you don't want large amounts of it, because what it does is it binds up your hormones. And when the hormones are bound to it, they can't essentially be used by the body, right? So we only use the free circulating forms of testosterone and estradiol and those sorts of hormones, right? So when you get an elevation in SHBG, you functionally are in kind of a hormone deficient state. And even when you stop the birth control pill, sometimes you'll see some correction of that SHBG value, but it usually doesn't go back to what it was prior to starting the medication. I'm not going to get on a soapbox about oral contraceptive pills. They do serve a purpose, right? And it's not like I tell all of my female patients, I don't want you, having an unwanted pregnancy, so we need to figure out some other alternative, right? But maybe we'll consider an IUD, which doesn't cause these issues. Mm-hmm. We talk about alternatives to the birth control pill. So the first step is getting them off of it. And then often we'll have to put them on testosterone. It's usually the hormone that's the biggest culprit of sexual pain. And so we'll put them on testosterone to essentially cause higher levels of T to overcome the SHBG problem.
Okay.
So if you think about it like as a pool of testosterone, we're increasing the pool so that binding protein is binding a smaller percentage of the total testosterone.
What other treatments do you offer in your office? I know there's been so much advancements lately in technology for sexual health.
Yeah, probably the most exciting thing that we do is kind of in the regenerative space, right? Okay. So how can we restore the function of tissue that may not be working the way it should? Or how can we use other types of regenerative therapies as an adjunct to hormone replacement therapy?
Okay.
Right? So we do low intensity shockwave therapy in my office for men who have erectile dysfunction. So a lot of men don't think they have ED because they can get hard. But if you can't stay hard, then you also technically have erectile dysfunction. So difficulty achieving or maintaining an erection.
Okay.
There can be a whole host of things that could be wrong, right?
Okay.
It could be performance anxiety. It could be a hormone problem. It might be a cardiovascular issue, right? They might have a blood flow issue. So we do hormone testing. We evaluate men's erections using an ultrasound to measure their blood flow, make sure that that's normal. And then we start talking to them about treatments, and a lot of times it's multiple things. We're putting them on hormones. We're giving them medications that improve blood flow. We're talking to them about the potential benefits of shockwave therapy.
Okay.
And so the way that therapy works is that it's an energy-based therapy. It sounds terrible. Shock sounds really painful. It's not painful at all. And what it does is it stimulates the body to release growth factors that then promote new blood flow to the area, help cellular turnover so that you get essentially better functioning tissue.
Yeah, a lot of time it is just a blood flow challenge, right?
Yeah, and these are technologies that are used elsewhere in medicine, right? Like, for instance, we do like laser treatments for women who have sexual pain or dryness. It's a CO2 laser, similar to the CO2 lasers that people use on their face to help promote collagen. The Mona Lisa is the one that we use.
Okay, and there's a few of them out there. Okay, so the Mona Lisa is it goes internally, right? And you use lasers to stimulate collagen again,
exactly.
Right?
Yeah, so it essentially kind of plumps up the vaginal mucosa. We also use it to treat externally on the vulvar tissue. A lot of women have vulvar pain or vestibular pain, and so we can use the laser to treat that as well.
Okay.
But you're going to see a lot more of this.
Yes.
And right now the data isn't the best. I mean, there does need to be better studies that are done. In most of these cases, especially when you're talking about something like shockwave therapy, there has been little to no evidence that it causes any harm, right? So if you're somebody who's looking for any solution to help you perform better, many, many men benefit from shockwave therapy with little to no risk.
And so if they do that, then can they throw away their Viagra?
Sometimes, yeah. I mean, it just depends on how good or bad their blood flow is. So I have some guys who, don't even respond to Viagra, and then we do the shockwave therapy, and suddenly they start responding, and they're thrilled with that, because once you stop responding to Viagra, we're talking about injection therapy, we're talking about penile implant surgery.
Yeah. It's really comprehensive. That's what's really impressive about what you do. There's some places that just like have just the treatments, right, or the technology, but it's like you are doing the multi-layer.
We want to do diagnosis
right?
and treatment, and we partner with a lot of other types of providers, a lot of therapists, sex therapists specifically, pelvic floor physical therapists. So it's a team of people that you really have to bring on board a lot of times, because these issues are so complex, right? They're not just one thing.
Going back to HRT, hormone replacement therapy, not just for, I guess people think it's always about like gender reassignment. It's like, no, it's actually something, especially for women. We had that Bunk Women's Health Initiative study, was it 2002, I guess, when that came out, and it was like, hormones are bad. Women can't take hormones, or women were taking hormones 40 years, probably like my mom was taking it, right? So now this whole generation of women has been like, I just got to suffer through perimenopause, menopause. I don't even know what it is though, because no one ever talked to me about it. But the studies now are saying, right, estrogen is probably safe for most women.
So, I mean,
what's your take on it?
Most of what you said is pretty accurate. I think the biggest issues with the Women's Health Initiative, aside from them having analyzed the data now 20 years later and shown no difference in mortality between hormone replacement therapy and placebo, aside from that, which is a huge point, is that in the initial trials, they were looking at women who were taking essentially synthetic hormones, not the type of hormone replacement therapy that we're doing. These were oral conjugated estrogen treatments, right?
Okay.
That's not what we do when we replace estradiol now. Secondly, a lot of the women in the study were very old.
They were older,
yeah.
Right.
And so when you're talking about risks of blood clots and strokes, right? Like, a lot of those women were probably at, increased risk already because of age and what we know happens to the cardiovascular system.
Yeah.
So a lot of the conclusions that were drawn, you could argue weren't totally valid. And then when you talk about real risk, the increased risk in breast cancer, which was one of the things that people were really terrified, was statistically significant when they reanalyzed the data 20 years later. But we're talking about like a minuscule increased risk of something that's already pretty low risk. Right. But that's not how it was portrayed. It was, if you take hormones, you will get breast cancer, or you will have a heart attack or stroke and die.
Exactly. So all these women, which is about 8 to 10 years of their life, they're in perimenopause to menopause, didn't have any solution. So now women are like, they're coming at it and they have questions. I know personally for me, like I've tried it all. I guess it's been about 7 years. I've tried the pellets, the hormone pellets. I've tried the progesterone, estrogen, estradiol, all of it.
Every woman at a certain age, and this is probably, I mean, you could argue starting in her late 30s, benefits from vaginal estradiol. There is a ton of data, and this is going back 20 plus years from the 90s that has shown a reduction in urinary tract infections just with vaginal estradiol. So you could even take sex out of it and argue that there are plenty of health benefits for women as they get older to be put on vaginal estradiol, because think about how many elderly women are hospitalized because of UTIs, right?
So many.
So many.
Right, exactly. So
and some of those people will never make it out of the hospital. They will pass away or die from their urinary tract infection because it spreads elsewhere or something. Yeah. And so, as a preventative measure, vaginal estradiol, in my opinion, should be offered to any woman starting in middle age.
Yeah, I think so too. I know that my mom is 81 now and she's been on it since her 50s. Mm-hmm. She uses the ring, the est ring.
Yeah.
Do you still prescribe? Like, how do you know which one is right for you?
It just depends on what someone's preferences are. I usually will start with either a cream or they make like a vaginal estradiol tablet that's like so easy to put in. It's got a little applicator.
Just like insert it like a tampon. But
mm-hmm. We try to, meet women where they're at, right? Like I see women in their 20s and their 30s and their 40s and their 50s, and depending on where they're at, they need different things, right? So younger women are going to need higher levels of hormones just to function than a woman who's older than mm-hmm. that, So it just kind of depends on what kind of symptoms they're having. We tailor their hormone plan to kind of what they need.
What about testosterone? Is it still off-label use for women?
Yeah. So there's no.
What the hell?
I know.
Literally, you can't get it anywhere.
No, there's no FDA-approved testosterone treatments for women in this country. Until 2015, there wasn't any FDA-approved medications, period, for female sexual health.
2015,
yeah,
so almost 10 years
2015. Ago. That's when I started practice. I think it was right around there.
You go to your doctor, you're having perimenopause symptoms, which again, just to remind you, is a space of time in a woman's life that could last 8 to 10 years. And a lot of symptoms can happen, and usually because it's the loss of their hormones. But because we couldn't give hormones, they'd go to their gyno and they'd be like, maybe just have a glass of wine, take an antidepressant.
You're depressed, you're anxious, you're not happy in your marriage. There's a lot of gaslighting. That medical gaslighting that happens to women.
More for women than men, yeah?
I think so, yeah. When a man says he can't get an erection, no one's questioning that.
No, they're like, Viagra in every corner.
Here's a pill.
Here's a vending machine. Get your Viagra.
Exactly, and we've had these pills since the 90s, and, there were commercials with Bob Dole talking about them. So the normalization of male sexual dysfunction has been around for a while. There's a whole separate, discussion that you could have that talks about individual men having a lot of shame about sexual dysfunction, but I would say as a society, we're much more accepting of male sexual health issues than we are female.
If someone comes to you and says, like, I have like low desire, how do you handle that?
First, I believe them, right? These are tough conversations to have. So when you have someone being vulnerable enough to speak up and say, listen, I have this sexual health issue, the worst thing that you could do to that person is not believe them or dismiss them. And it happens so commonly. It happens with young men who say that they're having problems with their erections. It happens with women when they say they have no sexual desire. So it's happening to a lot of people. And then, a lot of times I'm seeing them and I'm like the third, fourth provider that they've seen. And they're told things like drink a glass of wine, or if they're a young man with ED, it's all in your head. But it's not always in your head. So if someone hasn't taken the time to try to really diagnose what the problem is, then they can't say that and be sure about it. And there's so much damage that is done to people with sexual dysfunction who are dismissed, because then they spin out in their head, right? And we know psychology is a really important part of sexual health. And if they are told that there's something wrong with them mentally, they're going to just carry that into future sexual encounters.
We also don't have a lot of education around our bodies.
People don't know about their bodies. People don't know. Because as a society, we do a terrible job of educating people. And, sex education for us, I'm sure, was similar in junior high. Yeah. Your PE coach talks to you about how to not get pregnant and how to not get STDs. And that's it. Basically where the conversation stops. Right. That's it. We don't learn about body parts. We don't learn about pleasure. So you're left to kind of figure that out through friends, media, right? And those are warped perspectives of what sex is really supposed to be like. So
it's so misleading.
And then that's just the general population. And then doctors are horribly educated about sex. We get very little sex education as part of our medical education.
So we don't have the education. You're in high school or middle school, you get a really bad information that says, don't get pregnant, don't get an STI, but then go have sex. We're not going to tell you anything else.
Right.
But then a lot of women, like we're saying, says they're put on birth control pills. I'm just always wondering, why can't men be more responsible? Male fertility is really something that I think that we need to focus on too, that men could they could do things too. They could get vasectomies, or we're freezing our eggs. They could freeze their sperm, right?
Yeah, totally. Yeah. I mean, I think in the same way that you're seeing kind of movement from women related to their sexual health, there is a little bit of a groundswell around men, I think, feeling more responsible, to be more responsible in the reproductive conversation. I mean, given the climate of reproductive rights being kind of rolled back, I've seen men come to my practice requesting vasectomy, and I ask them what their motivation is. And there's data showing increases in vasectomy consultations following the overturning of Roe.
Yeah.
And so I think you're seeing men, whether that be from pressure from their female partners or just them feeling a sense of responsibility on their own, wanting to be more involved in that conversation.
They don't understand. Actually, your sperm might not be all that.
Exactly.
It might not just be about our eggs.
I mean, 50% of infertility cases are related to male factor infertility. It's half of the cases. But somehow we kind of always think about infertility as kind of a female problem, or that's the default.
Yeah.
And it's just not accurate.
All right. It is not accurate. And I know something that you've worked on I'd love to talk about is why has there been such a drastic decline in sperm count and really testosterone, right? The last 40 years. I remember reading these studies too, like in the 70s, I think, or in the 80s. I think in the 70s, started, but in the 80s, they had all this conclusive data about why, like, so much less testosterone, which means less sperm, right?
Yeah, usually. I mean, there's a relationship
correlation.
between, exactly. What we do know is that it's a global problem, right?
Yeah,
so there's sort of a global decline in men's sexual and reproductive health. Namely, like we're seeing lower levels of testosterone earlier in life. We're seeing 50+% reduction in sperm counts since the 1970s. There's some estimates that say that if this trend continues, that most people won't be able to have children without some sort of assisted reproductive technology as early as like 2060. So, and these numbers are really alarming, and no one is talking about them.
Yeah.
Like, I don't think if you ask the average man that he would understand, number one, how important sperm count is, and number two, how drastically on the decline it has been in the last, since.
Absolutely. Could the low sperm count also be, would you say that is low testosterone is related to why all the young men are having ED now at an earlier age?
A lot of studies that have come out recently looking at the accumulation of microplastics in our bodies, right? Yeah. So they've seen it in testicle specimens, they've seen it in semen specimens. So there's definitely an environmental impact here. I mean, that in my opinion is the only reason you could really explain this global phenomenon, right? Like the whole world is experiencing this like increase in pollutants.
Okay, so what can men do? Like, what can we do now to help their fertility?
Yeah, so I think being proactive. First of all, we need to just educate men better, right? So understanding that this is like an alarming trend.
It's alarming.
Knowing that your sperm production is best in your early 20s, right? And maybe you don't imagine yourself having a family for another 15, 20 years after that. If you wait to that point, you may have a problem. And so, you can pretty easily test your sperm. They have at-home collection kits now. You can very easily and for not that much money freeze your sperm. So if it's something that you are interested in preserving, I would suggest that men have a semen analysis earlier rather than later.
Okay.
And if they are concerned about it, freezing their sperm, and then looking at taking supplements, making lifestyle changes that have been shown to promote, sperm health.
Yeah. Okay. So freezing their sperm. I mean, really, it's so expensive. We freeze our eggs. It's like I could buy a house or I could freeze my eggs. And then men are like, yeah, freeze your sperm right now. Every guy can just go in the bathroom and shove it in the freezer. No, I know you have to do it more technically speaking.
No, but they have at-home kits where you can literally do that. So you just, you collect it at home. They have a preservative. You pour the preservative in the cup. You send it to the lab and they analyze it and they give you the option to freeze it if you want. It's a lot more invasive for women to retrieve eggs.
I'll be right back after a quick break for our sponsors, so just stick around. I was so fascinated when I heard about this. You started this Popstar.
Yeah.
Which is, I was like, wait, what? This exists? Tell me more about the origin of Popstar.
My business partner, Brian, and I, sort of like a little pandemic project, when both of our practices, for obvious reasons, kind of slowed down, had been seeing a lot of men complaining of, a decrease in their ejaculatory volume, right? And
men of a certain age or just
it was I was seeing a lot of young gay men. That's just like kind of the population
okay.
that my practice attracts. But we see it in men of all ages.
Okay.
And we know that there's a decline in volume as men get older, naturally.
So they were coming to you and saying, when I ejaculate now, it's just not, it's like not as much.
Exactly.
It dribbles
I don't
out.
shoot the way I used to.
Yeah.
I don't make as much semen as I used to. And at the time when I first kind of brought the idea up to Brian about like, can we find a solution for this problem? It was all related to pleasure, right? So I was seeing guys saying sex isn't as fun. My orgasms aren't as intense.
Oh.
And it's because I've noticed this problem. And so we launched the initial Popstar product, which was a volume and taste enhancer, a couple of years ago as just sort of a pet project, and have been really thrilled with how many people have found this product and said like, oh, this is something that bothered me, but I never knew to talk about it, or I didn't know that there was a natural option, because there are some medicines that we can prescribe, but a lot of men, that's not a problem that they want to take a medication for.
No, right. It's
and
it's
so
a supplement they could take every day.
Exactly. Yeah.
So let's break down the volume and the taste part of it. So volume is more like, I just want more. I want it. It doesn't feel good when nothing comes out.
Yeah. Yeah. So,
like,
I mean, if you think about it from like a physiological phenomenon, right? The idea of ejaculation and orgasm. When you orgasm, the intensity of that orgasm is often related to things like pelvic muscle contractions, right?
Okay.
Your pelvic muscles are going to have to contract more if you have more to expel, right? So a lot of men will report more intense or more pleasurable orgasms if their volume is higher. And a lot of people, when they first hear about our product, they're like, why would you want more? You know what I mean? And that's what we tell people is that for a man, when you are expelling more fluid, more contractions, more intense orgasms. So that was our initial product launch. And when we were kind of formulating it, we thought, well, can we make a supplement that is kind of hits all the aspects of ejaculatory health? What are other things that people complain about when it comes to semen? And a lot of people like talk about taste, right? So we're like, can we put things in there that neutralize the taste or make it less bitter or sweeter tasting? Okay. Bromelain is the primary ingredient. So it's the pineapple. Okay. So the joke is that we tell people is, if you wanted the same effect that this gives you from just eating pineapples, you'd have to eat like, piles of pineapple. It's all concentrated in there. And again, it's not going to necessarily make your stuff taste like pineapple, but what it does is it kind of neutralizes a lot of the bitterness that people complain about. Where does
bitterness come in? If someone has bitter sperm, could it also be related to the foods they're eating, their nutrition, right?
Yeah. So what we consume ends up like in the fluids that we produce, right? So classically like asparagus, right? People eat asparagus, their pee starts smelling, right? Smokers will often have more bad tasting semen. All the things that we do to our bodies, alcohol, certain
fried food.
Yeah, exactly. All those have to make it out somehow, right? So they come out in our urine, they come out in our tears, they come out in our stools, and they come out in our semen.
That would make sense. Let's talk about, you were in Poosh, your article about cum velocity.
Yeah.
I just love that. Ejaculatory force.
Yeah.
And larger volumes are important for fertility though, which is going back to the conversation of men taking responsibility for their fertility.
We got a lot of men asking us about the potential effects on fertility. Would this make it easier for me to have kids when we launched the first product? And then Brian and I individually have been on our kind of own reproductive journeys. Brian is open about how he's had both of his children through IVF. I'm currently kind of in this navigating the surrogacy process.
Oh, you are.
And so we just felt like it was a natural next step to make the second product a fertility focused product, because while there were some ingredients in the initial product launch that do support semen health, we wanted to make sure that we created a formula that was specifically designed to like make you make better sperm.
How does Popstar actually work then? You take it every day?
Yep.
Okay.
Yes, you take the volume and taste enhancer is 4 capsules daily with 16 ounces of water, and the fertility supplement is 3 capsules a day.
Okay.
Yeah.
Okay. And you've seen...
Yeah, I mean, we actually have,
like
people on Amazon writing reviews being like, we've been trying for so long, we finally got pregnant, which is just like, it's fun to hear when people are like, oh, my sex is so much better. It's a completely different feeling when someone's like, I'm going to have a family now.
That's such a great service to provide. Like, it seems like it's it's a question that comes up a lot about semen, about how to make it healthier.
Exactly. And there's stuff in the formulation that is a promoter of men's sexual health in general. So zinc is really important for male sexual health.
Zinc.
L-arginine, which is a vasodilator. So a lot of our customers will report that their erections are better. They're getting more morning erections. Some men will even report that their desire has improved. So there are ingredients in there that promote men's sexual health in general. Yeah. I mean, sex is so, that's the silly part to me, and what I like can't wrap my head around is like we're simultaneously both like obsessed with sex and don't talk about it. Media is like sex, 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 but then like no one has conversations about like, well, how do we navigate this? How do we have satisfying, pleasurable sex, right?
Yeah.
And so this like dichotomy, these two worlds that we kind of live in,
right?
It's just so silly.
This is it. It's frustrating. That's why we got to keep doing the work we're doing,
Exactly,
right? Every freaking day, all day. I'm like, no, we don't have. Yes, we're a sex society. There, you can download sex. You can look at sex 24/7. You can find it, but you don't really know your own body and what makes you feel good.
Yeah.
I want to talk about the overturning of Roe. Plus, also people have this resistance to IVF. Like the people who say like, oh, we're investing in families. They're also saying no to IVF. So how does like our country like actually invest in the future of family creation?
The ridiculous part of that argument and what people really, and maybe they'll learn eventually, is going back to what I said earlier, this is a global problem, right? So a lot of people that use IVF now, the perception is that those are people that have non-traditional families, right? The reality is that if the current trends continue, everybody is going to have non-traditional families in the future. So if we're about promoting family building, then we should really get on board with these assisted reproductive technologies and understand how they help people have families, because we're all going to be in the same boat unless something drastically changes.
God, every day we're learning something else about the future. Like it's not looking great right now. But I mean, really, so I just love what I do, what you do, because we're actually giving people really useful steps to be preventative. Like this is happening, people. Like we're telling you, like it's on the decline. Your sperm's on the decline. Your sex life may be on the decline.
Yeah, and I think as with a lot of things in health, we need to shift more towards prevention and not like reactive care, right? Like I can do so much more for you if you come in wanting to be proactive about maintaining or optimizing your sexual health, as opposed to you having been dealing with some problem for 5 to 10 years, right? There's still solutions for you and we're still going to be able to help you. But like if you are proactive about seeking care for these issues, so much more can be done, right? And we can be given the tools earlier to prevent some issues from coming up.
I wanted to get into questions that we have for you from our Sex with Emily family. Let's talk about circumcision. So, dear Emily, I have an uncircumcised penis and I worry when I'm with someone that they're going to judge me. How do I increase my confidence? Do you get a lot of questions about, or do people come in like they're worried about their penis size?
I think there is in this country, obviously, like more men than not are circumcised, usually when they're initially born as infants, right?
Right.
And so there's a lot of misconceptions about what it means to be a man with foreskin. The reality is that globally, it's more common to be uncircumcised, right? And again, I think it goes back to education, right? People with foreskins have problems when they're not taught how to take care of their foreskin, right? So we see people develop infections. We see a condition called phimosis, where the skin gets tight and can't be retracted, and that can cause pain during sex, or you can develop like little lacerations or abrasions because the skin is too tight. But a lot of that can be prevented by teaching young people how to take care of this part of their body.
They see an owner's manual.
Yeah, exactly.
For their penis. Like, this is what you do.
I think we should, going back to the sex education piece, like the conversations that we had in junior high, that's like too late, right? You need to start talking to children about their body parts, right? And not having it be this weird, your private spot or your pee-pee, or, kids can handle it, right? You can say penis, you can say vulva, and it's going to help them understand that this part of their body is the same as their hand, right? It's just another part of their body that they have to take care of, and to give them the tools early on.
That's when the shame starts then. If you're like, oh, it has no name, well, then if it has no name, then it must be something I can't talk about.
Exactly. So
speak about.
Sorry, to get back to your listener's question, I think that first of all, I would say if there should be no shame about having a foreskin. It doesn't make your penis weird. It functions exactly the same way. And so I would encourage that person to try to continue to tell themselves that, so that they don't feel ashamed or have a lack of confidence. Secondly, if you run into a partner who makes you feel that way, you probably should try to find a new partner.
That's
because there should be no reason that someone reacts that way to, again, an otherwise normal body part.
We should know that it's really no different. And men who do have foreskin tend to, again, I don't know, I don't have a penis, but they can have more sensitivity. They can have a lot of pleasure.
Exactly.
Maybe in different ways. That could be really exciting.
I mean, we only recommend circumcision in my practice when people have these very specific issues. I never encourage someone to undergo circumcision for cosmetic reasons. I tell them.
Right. People come in and they want it like later in life. Like,
and I have to have a conversation with them about like, I understand your motivation. Maybe they had a partner that shamed them or whatever, but this is a really sensitive part of your body, right? That I'm sure has provided you a lot of pleasure over the years that we're going to remove. And once it is removed, I can't put it back. Yeah. So, I really encourage them to think about that before they pursue circumcision for purely cosmetic reasons.
Okay. That's helpful. Love your body. Love how it is. Accept it. Yeah. Work with it. Everything's okay.
Yeah.
You're all fine. So what would you say, when could someone start taking hormone replacement therapy? What is that age that you think is appropriate for men and for women?
So I don't think there's a specific age. I think it just depends on the person. So let's talk about women and menopause, right? If the average age of menopause is 51, that's an average. There are a lot of women that start that process earlier. And then you tack onto that 10 years before, right? So there are some women that will start menopause at 45. That means that at 35, they might start having symptoms of perimenopause. And they can be really subtle symptoms. They can be forgetfulness, trouble concentrating, brain fog, fatigue, low sexual desire. And so a lot of women don't know to look out for these symptoms, don't understand why they're experiencing them, maybe mention them to their doctors and are dismissed. Again, drink the glass of wine, you'll feel better. Women in their 30s can start, if they're having symptoms, having those conversations with providers and say, hey, something feels off. People are very intuitive about their bodies, right? When something feels different, is not responding the way it used to. And so when that process starts at any age, it could be a man with erectile dysfunction in his 20s. Just because he's in his 20s doesn't mean there may not be a problem there that's causing him to have problems with his erections. And I would encourage anybody, if you've noticed a change in how your body normally functions, speak up about it.
What are some changes that they might see in their genitals as they age?
So
what to look out for? Yeah.
So penises get smaller. Everything gets smaller. Everything atrophies, right? So vulvas atrophy, vaginas atrophy, penises atrophy. That just all means shrinkage, right?
Yeah.
It withers away. But that's because our body, the circulatory system doesn't work as well. So you're not getting blood flow to the erectile tissue. So you're not getting as good quality erections. Or when you're talking about the clitoris, you're not getting clitoral engorgements in the same way. So all of that stuff atrophies related to a decline in our cardiovascular function and a decline in our hormonal function. So there are a lot of men who see me in my practice who complain about like their penis having shrunk over the last couple of years. And unfortunately, we don't have a lot of things that regrow penises. So again, it's about prevention, right? It's about doing things lifestyle-wise, dietary-wise, things like exercising regularly, eating healthy, getting good sleep. These all promote, better cardiovascular health, better hormonal health, to try to prevent or stave off that atrophy.
It could be preventative, but it still might shrink.
Exactly. Yeah. I mean, we're all battling time, right? Yeah. We all are on that journey together. And there's certain things that are inevitable, but I don't think people appreciate how much can be done to prolong that process.
Yeah. And then for women, if they're seeing that atrophy or the pain or the thinning of the vaginal walls, adding the estrogen can help them with the regrowth.
Exactly. Yeah. And younger women, it's crazy to me because I see younger women who are years away from perimenopause and menopause, having very similar symptoms as women in perimenopause and menopause.
What do you think that's about?
So a lot of them, it's because of their birth control, right? It can cause atrophy of their genital tissues. It can cause dryness. It can cause pain. And we don't take women seriously a lot of times when they're younger, complaining about these things or attribute it to other things, depression, anxiety, problems in their relationship. And a lot of times it can be solved by, getting them off birth control and putting them on some sort of hormone.
And then a lot of times I found too, exactly, like they get on the pill, but then they do get anxious, so then they're put on antidepressant, and that's like a double whammy, because then that's impacting their desire, perhaps.
Totally. Yeah.
Okay, so I've got one more question. What's your take on semen retention and men holding their ejaculation? I know it's trending.
And just ejaculate. It's like one of the few things that we have in life that's pleasurable, right? So no, there is this whole no-fap semen retention movement online that is a little like weirdly, in my opinion, based in like kind of misogyny. Like it's this like weird,
interesting.
Like, you know, it's about like male power, and you lose your power or sacrifice your power like through ejaculation. And so be stronger and more masculine and more virile. You like hold on to your semen for as long as possible. It's a very weird space, and it's not based in any kind of science. Maybe someone feels a little bit more energetic if they're, you know, not ejaculating as often, but that's an individual feeling. That doesn't mean that somehow not ejaculating is going to make you more powerful or have more energy.
Yeah.
You know, and some people will say like, well, you know, Olympic athletes, like when they're training or when they're at the Olympics, like they're not having sex and they're told by their coaches not to have sex. Like that's a very specific kind of person.
We're not Olympic athletes.
And again, I think you could still make the argument that I think if they ejaculated, it wouldn't really affect their performance all that much. Yeah, I think it's a silly thing because there's so much going on around us, right? That's just hard to get through every single day. Like sex and ejaculation is like one of the few things that we have as a people that's pleasurable.
Exactly. Like you got a hot plunge, cold plunge, not ejaculate. Like what the fuck are we doing? No, but I guess, I've heard some of the same things, and that's sort of based in like an ancient, like in Taoist practices, right? Where men are holding on to their energy, and then it's like this, you know, it's like their chi. Every time they orgasm, they're giving away their chi. So you have to learn, and a lot of men I know are taking more of the spiritual route of it, of like they are learning to orgasm without ejaculation, which is a practice. Yeah. But I can't imagine, I know many men who are really going to sit and like some do, but that's a whole journey.
And there is, you know, there is the idea of edging, which when done properly can heighten the sexual experience, right? It can make that final orgasm more intense. But this sort of intentional, like, I am not going to ejaculate for the entire month of November, like, is just silly. Yeah. You know what I mean? I
Could it be harmful though, or just?
I mean, there's not a lot of data on it, but there was a study that showed a reduction in prostate cancer incidence in men who ejaculated more than those that didn't, right? So I mean, who knows? That's convoluted, but like, you know, if anything, there's more data to support ejaculating more often is better for your health.
Okay.
Yeah.
There you heard it, guys. This is a lot of semen information that I don't think we've done such a deep dive on.
Well, that's what we're about.
Semen.
A lot of semen.
This is what I love. You really, no, I know. Yeah. And it's like, I love that you're all about the health of semen, how we can have more of it and stronger erections, because, you know, happy penis is like happier life, I would think.
Yeah.
Your penis
happy
is
genitals, happy life.
Happy genitals, happy life, for sure. Okay, that was very helpful. Now I'm going to ask you the 5 quickie questions we ask all of our guests.
Okay.
Are you ready? Like, we don't have to think it first thing that comes to your mind.
Okay.
Ready? Right. Okay. Your biggest turn on?
Ooh, intelligence.
Biggest turn off?
Close-mindedness.
What makes good sex?
Whatever feels good to you.
Something you would tell your younger self about sex and relationships?
Don't overthink it.
What's the number one thing you wish everyone knew about sex?
That if it's not good, that there's a way to make it good.
Oh, I love that. Okay. Dr. Josh Gonzalez, this was wonderful. It's so nice to meet you.
Yeah,
I think you're doing such incredible work. How can people find you, work with you?
Instagram, I'm at Joshua Gonzalez, MD. Popstar has accounts too, Popstar Labs on TikTok and Instagram. And yeah, I mean, I just use my social media, as you've seen, to kind of help do what we did here today, right? Educate people, do it in a disarming, entertaining kind of way. Yeah. Yeah. And then if you're in LA or you're interested in a virtual appointment, we offer those, joshuagonzalezmd.com.
Oh, yeah. We'll put a link in the show notes.
Yeah.
Oh, that's great. They can see you virtually.
Yeah.
Okay. Thank you so much for being here. I really appreciate you and your time.
Yeah.
And the good work you're doing.
Thank you so much.
Thanks. That's it for today's episode. See you on Friday. Thanks for listening to Sex with Emily, and be sure to like, subscribe, and give us a review wherever you listen to the podcast, and share this with a friend or a partner. You can find me on Instagram, YouTube, TikTok, Twitter, or X, and Facebook, all at Sex with Emily. Oh, and I've been told I give really good emails, so sign up at sexwithemily.com. And while you're there, check out my free guides and articles for more ways to prioritize your pleasure. And if you want to ask me about your sex life, dating, or relationships, call my hotline, 559-TALK-SEX. That's 559-825-5739. Or go to sexwithemily.com/askemily. Was it good for you? Email me, feedback@sexwithemily.com.